Today, we're going to have a great conversation about healthcare and rising long-term care costs. So, Joseph, today I want to talk about one of the biggest wild cards that can be in retirement, and that is the rising cost of healthcare. It's insane right now.
Yeah. I mean, we're seeing it again, even just with Medicare premiums going up into 2026. Those are increasing by 10%. I mean, when you look at history too of how much those Medicare premiums have risen by, it is quite astonishing, especially it's a joke compared to what you get on your cost of living adjustment with your Social Security. It doesn't really make much sense there.
Right.
But even private healthcare, even paying for things out of pocket, drug costs, it's insane of how expensive things are becoming. And the amount of money that you look and you see somebody spends over their retirement on healthcare costs, not even factoring in what they're going to have if they go through a long-term care event.
Right.
Which when you have a couple and you're 65, I believe the stat is 70%, at least 70% chance that one of them is going to go through some form of long-term care event. And again, remember, Medicare does not cover long-term care events.
Right.
That is completely separate.
We've got to separate what long-term care covers, what Medicare covers. And the bottom line is that when it comes to healthcare, you're going to get to 65 years old, let's just say, and then all of a sudden you're on Medicare. So healthcare over that term before you get to long-term care is a completely different subject than long-term care. And people don't know how to separate those two things. So NIRS did a study. 66% of retirees are concerned about healthcare, but 80% are concerned about long-term care. They literally are two different events.
I really do think that a lot of individuals, when they think about long-term care for their situation, they see how expensive those prices are. Even right now, I mean, what, between $10,000 and $12,000 a month for good long-term care. And they just kind of shut off because they're like, well, there's no way.
Right.
There's no way I'm going to be able to afford that. So they don't do anything about it, which is kind of a silly thing to do. You can't shut down for that problem.
Well, avoidance is so much easier than honesty.
Exactly, right? I mean, instead of avoiding that issue, like what we do with our financial plans is let's factor in a long-term care scenario. Let's show you if you can self-fund a long-term care. That way you're not relying on any form of policy for a long-term care event. Let's just see that first. And then we can maybe build some different ways to strategically fund how you're going to pay for that long-term care event. But you're never helping yourself by avoiding that issue or just thinking, I'll cross that bridge when we get there, because it's only going to get more and more expensive.
One of the biggest issues that we've seen in our practice is that when somebody progresses through life, they decide to move elsewhere. So what they're going to do is they're going to move more towards family somewhere. What we're seeing is that if a person leaves Florida and actually moves to Massachusetts, long-term care expenses are twice the amount up in Massachusetts than Florida. And people don't consider that. This is my opinion. I don't think enough people are factoring in healthcare planning and long-term care planning in their financial plan. And the whole reason for that is there's not enough people that even have a financial plan out there. So how are they actually factoring in for these two things? And it's a huge issue. These are going up. These costs are going up 6 to 6.5% per year. And so regular inflation for like normal living, housing, utilities, gas, and groceries could be at 2.5 to 3%, but healthcare and long-term care, 6 to 6.5% easily.
Massive, right? And I mean, and you have to factor that in too when we're running financial plans. We add that into that scenario, especially when we're looking at a possible long-term care event. You can't run that at the same rate of inflation. But I think something that individuals end up doing when they're thinking about their retirement is like, well, my healthcare expenses for this year weren't crazy. So why would they get crazy in the future? You're not even proactively thinking about that. But again, as you get older, there's a higher likelihood that you're going to experience some kind of event that's going to cause more out-of-pocket expenses, and those healthcare expenses are going to increase for your situation.
So right here, Protected Income did a study, and they show that people most concerned about retirement is 67% have a problem with inflation, 60% have a problem with healthcare, 42% of people believe that they're going to outlive their savings. So these are, again, huge issues that we have in retirement, and there's not enough people that are doing financial planning or income planning, but also don't understand their portfolio if that can provide a rate of return to actually be able to pay for these. So 5 things that every retiree needs in retirement is a financial plan, a tax plan, an income plan, a portfolio, and also concierge service. So if you are looking for those and you are concerned about healthcare and also long-term care, go to myincomeplan.com and download your very own retirement income guide. Thanks for watching, and we'll see you on the back roads of retirement.
Do you have questions and concerns about your money, lifestyle, and retirement? Like so many, investors today worry about living expenses, healthcare costs, inflation, and stock market volatility. Instead of worrying, start planning. Eric Kearney and his team at Retirement Wealth Advisors want to sit down, get to know you, and start to build a plan that matches your vision and goals. Let's have a real conversation about what's important to you and how we get there. We'll help build you a plan based on your goals, lifestyle, and income needs, with financial clarity over complexity. Call us today for a farm fresh second opinion. Remember, you only retire once, so let's get it right the first time. Thanks for riding along with us today. We hope you got some good dirt. If you liked today's show, subscribe, like, and share with all your farm truck friends. We hope you'll join us for the next ride on Farm Truck Financial, where we're always planting seeds for a better future, 1 mile, $1 at a time.
Farm Truck Financial, we're riding with you down the back road steady.